Hello everyone, welcome back to my channel. This topic is peritonsillar abscess from medical surgical nursing. Let's get started. Abscess is a deposition of pus at any part. Now peritonsillar abscess becomes deposition of pus around the tonsillar region where because of any infection, any bacteria, any pathogen, there is deposition of mucus product at around the area of tonsils. This abscess can cause pain, swelling, and blockage of the throat. Also, speaking can become difficult. The peritonsillar abscess are generally uncommon or rare. When they do occur, they are more likely to occur in younger adults, older children, and adolescents. It is a comparison of normal anatomy and peritonsillar abscess. Because of deposition of the infectious product, tonsils becomes swollen and appears something like this on the right side. Etiology can be chronic tonsillitis, infectious mononucleosis, smoking, chronic lymphocytic leukemia, or stones deposited in the tonsils. Clinical features can be mouth and throat may show a swollen area of inflammation. Just like in the diagram, there might be a swollen area inside the mouth. The uvula may be shoved away because of one side of the mouth is swollen. Uvula can be shoved away, same like in this diagram. Because of this inflammation, uvula has been shoved away from its normal anatomical position. Also, lymph gland in the neck may be enlarged and tender. Following associated signs and symptoms are painful swallowing, fever and chill, spasm in the muscles of jaw and neck, which is called as neck twisting, which is called as torticollis. There can be ear pain on same side as the abscess. Voice might become muffled, which is also described as a hot potato voice. Sounds like if you have a mouth full of hot potato when you start talking. So voice becomes muffled. There is dysphagia. Also, when the person tries to swallow saliva, that is also painful. Medically, we can manage by providing antibiotics, clindamycin, erythromycin with its respective doses. This can be given to both older children and adolescents and adults. For pain, NSAIDs, ibuprofen can be given. Also, patient needs to take enough amount of fluids to stay hydrated because body is undergoing infection. Surgically, if there is a peritonsillar abscess, it can be managed by surgically resectioning the part. The first, surgeon inserts a needle in the pus pocket and then drains away all the particles from there. If there is no immediate danger, the procedure will be kept painless as much as possible, but still a local anesthesia can be used to avoid the pain. During that suctioning, pus as well as blood might come outside. Also, needle aspiration can be done to withdraw the pus into a syringe. Acute tonsillectomy can be done where the tonsils should be removed. Complications can be airway blockage, bleeding, dehydration, infections of the tissue, pneumonia, meningitis, and sepsis. That means the same bacteria can enter all the neighboring organs and cause infection. Next disease is adenoiditis. It is a condition where adenoids get inflamed and enlarged after getting infected, and problems like respiratory infections and difficulty in breathing occurs. Adenoids are a piece of tissue which is located at higher part of the throat. Adenoids helps in fighting against the antigen or infection by producing antibodies. These are adenoids. So when that adenoid is swollen or inflamed, adenoiditis occurs. It can be caused due to infection in upper airway tract, allergy, It is commonly seen in children below 10 years, also due to genetic history. Clinical features can be stuffy and blocked nose, ear problems like hearing difficulty, pain in the ear, sore throat, snoring, sleep disorder, cracked lips, difficulty in swallowing, dysphagia, swollen neck glands, dry mouth, sleep apnea, ear pain, and infections. We can diagnose the condition by using an X-ray of the same region, throat region, or performing complete blood count. Because of infection, we can monitor the level of WBC, RBC, platelets. Medically, if we want to manage just the symptoms, inflammatory symptoms, then antihistamines and corticosteroids can be drug of choice. Also, to relax the airway, nasal decongestants can be provided. For the main treatment, that is against the pathogen, antibiotics can be used. Or if there is viral infection, then antivirals can be used. All the medicine have its own doses and its own time period. As a nurse, it is our duty to put the patient in a complete bed rest so that tissue rejuvenation can occur. Patient should avoid active and passive smoking, which can be an aggravating factor. Fluid intake should be encouraged so that there won't be any fluid and electrolyte disbalance in the body. Diet should be protein and fiber rich. Also, proper follow-up should be done so that antibiotic cycles can be completed and effectiveness of treatment should be monitored. So, patient should be educated about proper follow-up. Complications of adenoiditis can be foul breathing and breathing through the mouth, always breathing through the mouth, speaking with a nasal tone, runny nose, dry mouth, and loud breathing. Thank you so much. Next topic will be started in next video.